Hello, my name is Talisa Ramirez. I'm going to be doing the colostomy care video for BSN 206. I do have all of my appropriate supplies. I do have on my scrubs and badge. For the sake of the video, I will be removing my badge because I do not want it dangling over my patient. So let's get started. So I'm going to knock on the door, provide patient privacy, perform hand hygiene. Hi, my name is Talisa Ramirez. I'm going to be a nurse today. Can you tell me your name and date of birth? That is accurate based on the armband. Okay, so Mr. Jones, what we're going to be doing today is changing your colostomy bag and your plate, just getting you a new one, getting you freshened up. A couple things before we start. I do want to let you know, please try not to touch any of my supplies or to touch your area. We want to try to keep it as clean as possible. If you experience any pain during this, please let me know. And I'm going to get started. So I'm going to place on my gloves. First, we're going to remove the pouch. We're going to remove the pouch. Okay. Now, in this case, we would discard the pouch, but for video purposes, I have to reuse it. Also, we would measure the contents of the bag if that is what the doctor wanted. So in this case, he does not want that, and I have to reuse it, so I'm going to just put it to the side. We're going to remove the plate now, making sure to just be gentle and don't pull the skin. Try not to be rough on the skin. Okay, also we would toss this as well. Since I only have one, I do have to reuse it. Okay, so now I'm going to clean it with water and the approved solution. And you're gonna go around it, making sure to switch the rag. And around it again. And we are going to toss that into the dispose of that. From here, you want to measure the stoma. Now, while looking at this, you want to assess the tissue integrity. Make sure nothing is, in concern. It is beefy red, which is what we want. So now I'm going to measure. And it is 1 3/4. Okay. We would place that into the trash. Now from here, you want to dry around the area, making sure to pat dry. And again, making sure to turn the rag. Okay, you would place that into the trash as well. From here, you will want to put on the adhesive paste or gel, and you would put that around it. Okay, now since we've used this first, it has already been cut out, but in this time, you will be cutting out the appropriate size that you need for this. So now that we have placed the gel or the paste here, we're going to apply. You place it on. Making sure to just mash it, secure it. Okay. From here, you want to attach the pouch. And you're looking to hear a snap. Click or snap. Once you hear it, you know that it is connected good. Now I am gonna just place my hand over it. Since we did add the paste, you just want to apply a little bit of your hand just for a little heat to just kind of seal it. Okay, so now we want to make sure that the bag is securely clamped. My bag is, but in this case you would make sure that it is clamped securely. Okay, from here I am going to remove my gloves, perform hand hygiene. I'm gonna place my patient into a comfortable position. Do you need anything else, Mr. Jones? Okay, I am going to document, and I am going to communicate any concerns that I had with the provider, and we are done.